So I'm Dr. Sara Wasserbauer. Hey, Bob, how you doing?
I'm doing great. Nice to see you on the West Coast,
Yeah,
looking
I know
so
it's nice to. I
chipper.
like the Zoom stuff because then we can like see each other on the different coasts. For anybody watching this, hair doctors are usually in solo practice, and so we really like each other and love getting together and talking about these kind of things. So it's
That's
really
right.
nice for me to see Bob, who's one of the titans in the industry. And we're talking today about low level light therapy, which Bob just knows a ton about and was onto this way before I even was. So I was just saying that in our pre-op stuff that I was a skeptic for a long time. You said you've been using it since 95?
1990, actually, I was one of the
1990.
early adopters to take on this therapy that I find to be truly very effective, without side effects, easy to do, and very safe. So
Yeah.
back in the old days, I got a call one day from a company saying, "Well, we have this light therapy to treat and grow hair." And I said, "Well," and we were doing plugs still in those days, very large grafts that didn't
Yeah.
look so nice. And I'm saying, "We have so much to overcome with the public about transplants. I think, well, I'll pass on." That was in the late 1980s. And then 1990, I had a colleague who said that, he was using it. And again, those were office-based devices. They were big devices that
Big,
had
right. So I had the old revised 670, the one that went over. It was like one of those, well, women watching this will know, one of those hood devices that dry your hair at the
the
salon.
old-fashioned hair dryers. Yeah.
Yeah, old fashioned hair dryers,
Yeah.
exactly.
Well, the point of all this is that just like our iPhones change in technology every single year, and they do make some non-technological advances. They look better, they feel better, but the technology has changed. And with low-level laser therapy, which is also called today a very popular title, red light therapy, and the medical term actually is photobiomodulation. And what that breaks down to is photo meaning light energy, bio meaning, in our case, the hair follicle, and modulation meaning making a positive effect to the hair follicle using energy. So those three terms can be used interchangeably. Laser therapy itself is another one
Low
that's
level
used.
light therapy, red light therapy, cold laser therapy, back when they exclusively used lasers. And that term was coined by, in 1966, 1967, by Dr. Andre Mester, who's known as the father of photobiomodulation, because he determined, or he's the one who found, he was doing that study on the mice where he found that his light device was regrowing hair on the backs of mice. He thought he was doing cancer research, and he ended up finding low level light therapy. And what's funny about that is that one was serendipity too. He admitted in a conference with his sons that like one of the staff had the light turned on the wrong level, and that's
Uh-huh.
how he found it. So
It was too low. In other
it
words, it
was
wasn't
too
so
low,
hot.
right? It
Right.
was too low. It was supposed to be high, and it ended up showing
Early
that.
surgeons found the same thing out. They were using hot laser to debride, to
Yep.
clean out dead cells and dead tissue on skin, and they found that the skin adjacent to the
Right.
problem area was growing hair.
Yep.
So that's a low level term or lower energy term, and that's where we have this great therapy available to people, men and women alike, who are losing their hair.
There's one more
And
I can think of, and that is when they were using light therapy devices because they knew it helped with wound healing.
mhm.
And they were using them to help improve the blood supply to lower extremity wounds on diabetics, like a diabetic foot ulcer. And lo and behold, those areas that were treated, and usually the treatment area is very defined in light because you got the spot size, right? And so those were growing more hair than the air around it. And they're like, oh boy, this really does actually
It
grow hair.
works, doesn't it? It
It
works, yeah.
works. It works. And it doesn't have any, I mean, we've had this since the 60s, last decade or last, 100 years. And it doesn't have any side effects. Like this is not an ionizing radiation that causes cancer or something like that. And I remember when we were at the Panama meeting, one of our esteemed colleagues who really knows their stuff got up and asked it was the laser expert at the front of the room. Her name's Juanita Anders. She worked for the Department of Defense. He
Mhm.
says, "Well, how do we know this doesn't cause cancer?" And she just totally broke it down. She's like, "Well, it's non-ionizing It's not ionizing radiation. So I think that's part of the misunderstanding is people just don't understand what light does what, right? Some light and lasers remove hair. How can
That's
this
a big
like
thing we had to get over in the early days because laser therapy to treat hair loss, to remove hair, was very popular in those
right?
days. They were dropping lasers off in salons up and down the street where my office was. And, you know, people would be getting burned. And
Yeah.
now we come out and say we have this laser, low-level laser, that regrows hair, doesn't destroy hair. And we had to explain that quite a bit in the early days. But the beauty of photobiomodulation is that, as you said, there are no side effects. It's something that our colleagues need to learn more about as well, I think, because we have medications to treat male and female pattern baldness with minoxidil and finasteride and others now. And we know about those, and they affect the body in all different ways. Laser therapy, the easiest way that I describe it to patients is that it works especially to increase the capillary blood flow to the follicles. And I have this little birthday cake sort of.
Oh, I love that one. I have
This
that
is my
one here.
favorite one of all. We call it the
Yes,
birthday
I
cake.
love that one.
And it really describes what laser therapy does. So these are very thick terminal hairs that we all love. They're deeply embedded in the skin, and they're plentiful in number, and they're robust, and we love them. But notice the capillaries in the skin, the tiny blood vessels feed every single follicle. And then over time, what happens, there's decreased blood flowing to these exact blood vessels, and they become miniaturized. They get shorter and finer and less pigmented and less in number until finally they really become very tiny. They're even hard to see, but look at the blood supply is still attached to them. So what low-level laser therapy does, it works not in the coronary arteries, it works right in the tiny capillaries nourishing each of the follicles.
Yeah, and
And
these
one of the
capillaries
biggest points.
are like literally wrapping the hair is important, like just from the amount of attention that the blood supply pays to it. Like it is completely wrapped in these tiny little capillaries. And I explain it similarly. I said, well, it increases the blood flow to the follicle. That's number one. It increases the transcription of ATP for anybody in high school biology. That's the energy source for the cell. It reduces the inflammatory things, and it also just upregulates the growth factors of the follicles. So on so many different levels, it's going to be assisting with hair growth. Even if, and this is not a proven thing, so maybe I shouldn't even say it, but even with my patients who have like a scarring alopecia, head irritation, I find that because it you know, after a couple of sessions, they're like, my scalp doesn't really, you know, burn anymore. And it's not like you can feel the light therapy. It doesn't like feel like anything.
Right.
It's not a massage or something or a warm. I mean, I'd love it if
That
it
would
was.
have been nice if that could be added to the devices, right?
Yeah.
But
Yeah.
yeah, I've had many patients that this ATP and all these other biochemicals that the laser therapy actually impacts. It ramps up the mitochondria, the energy sources, the workhouses of every cell we have in the body, including the follicle cells,
Yeah.
and it grows the hair. That's
Yeah.
the end result. It grows the hair.
So the
And
cytochrome C oxidase is the photoacceptor.
right. So
Yep.
those are the things that really, really people, they need to know that these are the things that are happening. But I started using laser therapy in 1990. That was 35 years ago.
And you
And
always pair it with other, I mean, not always, but you feel very comfortable pairing it with other therapies, finasteride, minoxidil, surgery, everything.
I always do because each of these modalities, let's just talk about the basic three that are FDA approved or cleared. We have minoxidil, Rogaine, we have finasteride or
Finasteride.
Propecia, and laser therapy. Those are the only three that the FDA
Yeah.
approves or clears. And Rogaine works with its population of follicles, and Propecia or finasteride with its, and laser with its. So each one of them has its own population of follicles upon which it works. But if you double up, it's better than one. And if you triple up, it's better than two. So the more of these therapies one does, the better the efficacy. But each of them is a standalone treatment as well. So
Yeah.
some people don't want the potential side effects of an oral medication, for example, or they may have irritation from Rogaine. And so those are the things that we have to discuss with patients. What are your figures that you describe to patients as far as the efficacy? laser therapy.
I put it at the same as, like, if you're doubling, tripling up, clearly it has that exponential. It's not just additive, it's actually multiplicative.
Mhm.
So I'll say it's on the order of like a minoxidil. It definitely, some of the data is hard to compare. And a
Mhm.
lot of the data, because having a split head study, you're not really sure if
Doesn't work
you're
so well.
increasing the blood supply, to one side, you're probably increasing it a little to here because of the way the blood supply, for those of you who
They're all
don't know.
connected.
Yeah, exactly. The way that the blood supply works in the head is different than some other places in the body. It's an anastomosis. It's all a big network that's kind of redundant. And so you can't just have one little spot that you're getting. So, if you're doing it to one side, that's why it makes it a little bit difficult to evaluate the studies. And a lot of people have different wavelengths. They're using it for different amounts of time. Sometimes people have different amounts of hair, which might be blocking the light. I mean, different colors of hair will block the light. So I will tell patients it's on the order of minoxidil. And I also used to use it a lot more post-operatively. How do you use it with your surgeries?
Well, when we had those big machines in the office, part of my surgical protocol was to offer them laser therapy twice a week for 2 weeks post-operatively.
Yeah.
And what I noticed with those machines, and it has obviously come forth all these years with the latest devices we use, the CAP devices now, that I noticed, first of all, with hair transplantation, the little hairs that are planted originally grow and fall out after about 2 or 3 weeks. That's normal.
Yeah.
And then new hairs take about 3 or 4 months to grow. That's why everything, whether it's minoxidil, laser, finasteride, or hair transplant surgery, it takes about 3 to 4 months to see anything begin. It's sort of like a loading dose with medications. So those little hairs that fell out, the new ones started to regrow after about 8 weeks using the laser therapy, instead of the typical 3 or 4 months. And those hairs in the area of a transplant, the long hairs that were still there, they could undergo a postoperative shedding or shock. And I noticed that decreased dramatically, less shock.
Mm-hmm.
And the final thing is the hairs grew faster. So what we would see, right, the transplants grew faster. So what we would see at 9 months would be visible at maybe 6 months. And, with transplantation, with anything doing with the hair, people want everything done yesterday, right? We want everything done immediately.
Exactly.
As do I. I'm not any different from anybody else.
I know. I think that's why God put us in this, is to teach us patience.
It's true. And so what I notice is that everything happened more quickly. And the thing you mentioned about inflammation, with this being anti-inflammatory in effect as well, is that many patients who would come in with a psoriasis,
yeah,
and they're saying the psoriasis caused the hair loss. I'm saying maybe a little, but that's not what's caused your hair loss. But how many people came back with better results from psoriasis, less psoriasis,
less
irritation,
psoriasis, less itching, less
all
symptoms.
that.
I know. I would really love to have I don't have a derm practice per se. I'm almost all hair, but I would love to have a study that just goes through that. And I wanted to reiterate. So I come from a general internal medicine background. My studies, when I used to do a journal club in residency, were 50,000 patients, multi-center trials. This is the Framingham study. This is things with cholesterol and heart attacks and stuff like that. So I kind of came into that into the medicine of hair, looking for those big studies, right? And they just don't exist. And so one of my mentors, her name is Tanya Paul, a little shout out to Tanya, she's in Denver.
Hi, Tanya.
She actually, I was hanging out in her offices before I did my fellowship in hair. And she said, "What do you think of this light therapy stuff?" I said, "I think it's complete BS." And she said, "Well, actually," and I said, "What do you think?" She said, "I used to think that. And what I found is the hair seems to grow faster. There seems to be less inflammation. And I seem to have less shedding, like you just said. I seem to have less post-operative shedding." And she said, "And I can't quantify it. At that time, we didn't have those hair check devices. She didn't have a Canfield or a Trichoscan or any of that stuff existing. All they had was global photographs." Right. And that was her experience as well. So that kind of like put a little bug in my ear that, wow, this might actually have, even though it didn't rise to the level of that kind of scientific evidence. But I think now, after, what has it been, 50 years that we've known that low level light therapy really does help hair. Now we're finally getting that evidence in, and it really is so adjunctive for patients. I usually tell my patients, it depends how often you use it. It's like a drug, right? You have to dose it appropriately.
Use it faithfully, yes, everything,
Yeah.
faithfully.
Yeah, but it's harmless. I mean, put it by your bed a couple of times a week, every 2 or 3 days. You pop it on, you get the light dose, and then you can really, you can. It's just that additive little bump.
Right. Well, one of the earliest cap treatments. These are cap devices that have laser diodes built within them. The original study was a half hour every other day. That
Yeah.
was the treatment, a half hour every day. And I had many hundreds of thousands of patients probably using that type of protocol. However, I noticed that the problem with that, and myself included, was compliance. So I'd go to dinner with my wife and come home at 11 o'clock at night, and I'd had to have my cap treatment, and I didn't use it. I went to bed.
Yeah.
And if I remembered if I did it yesterday or not, that was another issue.
Yeah.
So when I spoke with one of the companies that creates these devices, and I said, can you do anything about this compliance problem? And they had a FDA-approved scientist who did all these studies to determine what's what, and they came up with using the half hour every other day was a pulsatile light, the laser pulsed. And so they made a device, non-pulsing laser, non-pulsing, that was used for 6 minutes each day instead of 30 minutes every other day with the pulsing. And they indicated that that matched the efficacy to the every other day pulse laser device. So I switched over from the quote unquote older half hour treatment to the 6 minutes every day treatment. And the thing that I thought was amazing that I noticed was that patients who decided either their older device had died or, pooped out, or they just wanted a more convenient protocol, I noticed that people had better efficacy using the 6 minutes each day versus the older one. But the technology was essentially, not the technology, but the efficacy was essentially the same. And the answer was that they were more compliant at 6 minutes every day versus a half hour every other day. And I saw better growth when they switched from the older one to the newer one. And so
Well,
I think that, the jury is always still out. There's always new information to gather. But these 650 nanometer diodes are in all devices, essentially all devices. And I think we're at a really good position now.
Well, and it's interesting to me, and I actually discussed this a little bit with Sharon Keem because it has a lot of interest in light devices. There's certain wavelengths of light that the cytochrome oxidate will accept. So the photoreceptor that's actually in your hair, which amazingly to me, like there's a light receptor that's 3 millimeters deep in your head, and there's also smell and taste receptors. Like, why is that there? I'll have to ask God when I get there. So making sure that it's within the wavelength that is an optical window is critical. Making sure that you're using.
Let's talk about that wavelength to let people know that's 650 plus or minus a couple of degrees, right?
Well, the 668 to 684 was the first one, and then there was another one in the like in the 7s, and then another one in the 8s. So around 830, 832, and then also there was some data that came out for, I think it's 450. So, but that one's just one study. And so I have a brother who has a PhD in photonics, which is the engineering of light. And so he and I had a big argument. He said, well, why don't you just give the whole dose of light in one flash? And so what I said, well, that's a good question. It turns out that biologic systems like low and slow for cell proliferation. If what you're trying to do is get cells to proliferate, they like a little bit at a time over long periods, right? They don't like a whole big amount at once. And that's actually the difference between removing hair and, growing hair.
Yes.
Is the power density, the light flash that kind of goes into the skin and heats up the pigment in the hair shaft, which is why you can't laser remove white hair. But when it comes to growing hair, making sure it's within the right wavelength, making sure the amount of light, it actually has something called the bleaching effect, which is how long it takes for the light to actually percolate into the tissue.
Mhm.
And unfortunately, there's no devices out there currently that actually get the light to the scalp, because that would probably help them to, just the physics of getting light into the scalp would probably assist. But low and slow is much more effective than all at once, or, too distant apart. Too little is not going to give you any effect at all.
Mhm.
Too much, like 30 minutes a day, that would be inhibitory.
Right.
And so you have to kind of thread this needle. And I think that that's always been one of the impediments for patients to incorporate this. I think we have a long way to go to getting that dosing right and really proving how well this can help individual patients.
One other thing that I think we should talk about is that, there are no side effects with this modality, but people are concerned about skin cancer, for example. I get that question
Yeah.
every day virtually.
Yeah.
And one of the things we can tell them that there's no UV radiation in these devices, none.
No,
And
this
that
is
UV
not iron.
radiation is exactly, as you said, the ionizing radiation. That's what proliferates cancer cells. So
Yeah.
we can assure people that it's not an issue. They don't have to worry about that.
Not at all.
And there's no systemic effect per se. It doesn't go into the body. The laser just goes literally a few millimeters into the scalp. So
Yeah.
it's not a worry as far as anything going beyond there. Are they worrying about their eyebrows growing or facial hair?
Or
That
their
doesn't
kid
happen.
putting their whole face in the mask, and that it is not something that has any, I mean, how many things about that can we actually say?
Yeah.
There's no negative side effects. I
Yeah.
mean, I suppose you could cosh somebody over the head with it like that. That would do more damage than, being exposed to that light. And you can't really overdose, from the sense that, like, if you overdose, you're not going to get the effect on your hair that you desire, but it's
Yeah.
not like something would actually cause a problem. You wouldn't burn yourself ever.
Right. That's another thing. They're worried about getting burned. So
No. Yeah.
I think that if people just realize the numbers that I tell my patients, this is over many, many years of experience that, well, first of all, we know that minoxidil and finasteride, the other two, if you stop using them, the effects will wear off after about 8 months. That's a typical thing. So it's, if you don't use it, you lose it.
Yeah.
One thing I learned early on when I had those big machines, we had a 1 year long protocol early on with the
Yeah, I
machines,
had one too.
and people came 3 times a week, then
Yep.
twice a week, all the way down, 40 treatments in the year. They were very determined patients. They were. And it was a 1 year protocol. That's what we knew in those days. So at the end of the year, they stopped. And what I noticed was that after about 3 or 4 months, which is that
3 or 4
magic
months.
time frame,
Yep.
only about 10% of people who stopped the laser would have shedding. Only about 10%. So those people, we learned, we put them on a protocol of like a booster protocol, I think we call
Yeah.
it. I mean, everyone was individual. Some people had to come every 2 weeks, some people every 6 weeks, whatever. And that doesn't happen with laser therapy. And now with cap devices that people purchase and they wear themselves, I tell people there's no reason for them to stop the therapy. I mean, there really isn't. There are no
Yeah.
side effects. There's no reason. It's convenient. And they're very portable, obviously. They're just a baseball size cap device that one wears. And I travel all over the world with mine, and I keep it in my carry-on bag. I put it
Because
on,
it gets
I don't
stolen.
bring it
Oh yeah, no, you and I had that conversation about how it is one of the number one most stolen things out of people's luggage.
out of their checked luggage.
Out
Out
of
of their
their
checked
checked
luggage.
luggage. Yeah.
That's what happened. People were getting them stolen by the airport personnel. So
Yeah.
I told them, and a lot of them come with carrying cases. Leave the carrying cases at home. Put it upside down in your carry-on bag.
Stuff a
Put the
jacket in them.
battery inside,
Yeah.
and fill things around it, and continue to use it.
Yeah.
One thing I think we should discuss is pregnancy. Using these during pregnancy. What do you tell your patients about that?
No problem. I
Okay.
used mine during pregnancy. I have 3 kids.
Are they hairy?
Yeah. But I
So
think that's more due to, the genetics of me and their dad.
yeah.
No, it's local. I mean, that is one nice thing about that we really know. It's a local effect. It's
Right.
not like finasteride being absorbed by the scalp and going systemic, because that would go to your liver and then be broken into inactive metabolites. But for light therapy, it's gonna just affect the stuff that it's on, which is evidenced by, when they were shining the lights to heal wounds, and they still use low level light therapy for wound therapy. Only the area that got the light grew the hair. So, that's one of the reasons why the Hair Max hair comb, which was one of the very first devices out there, truly groundbreaking, was a little, more difficult because, then your arm would get tired just using it. But it had the tines to part the hair. You got to get it actually down to the scalp. And like I was saying, I would love it if one of the devices actually got, direct photobiomodulation, because I think that might have even more of an effect than, having hair being blocked by the light, which is why they used lasers to begin with. First of all, you could really dial in the wavelength. And second of all, that would help get it through the hair.
Penetration.
Yeah. Do you still tell patients to wet their hair before using them?
I
No.
don't tell them to. The other thing that's relatively new is the near infrared range, the 800-ish.
The 800. Yeah.
That just in one of the journals last November, the dermatology journal. I don't know which one it was.
I don't remember which one that one is either.
Whole thing on. But 808 is now being used in combination with 650. 650 is typically the diode wavelength of almost every device, virtually every device.
I know, and I'm going to have to disagree on that. I don't think it's optimal. I think based on what I've read, and most of what I've read has been the laser textbooks that just talk about photobiomodulation in general, not just for hair. Right. But I think it's moving it into the 4 wavelengths that we know of, and of course I've forgotten them off the top of my head. But will probably be one of the next steps, getting this to be more effective. So there's a lot of upside. There's a lot of potential, even more so than what we have. And if patients are at all interested, it's an adjunctive therapy. It's such an easy thing to add in that really can be helpful, even if it's right after a surgery.
Right. Especially if it's right after transplant. So the idea of this, if someone's very bald, obviously, they're not, this is not the first line of therapy that we recommend. But people have to realize if they have genetic hair loss, androgenetic alopecia, they have a condition that's progressive. And if they do nothing about it, it's going to get worse. That is progressive. That we can promise things. We don't promise much in medicine.
Relentless.
We can promise
Relentless.
Yes, it's going to happen. So a mainstay treatment, a lot of people say, well, geez, if I can stay how I am and not get worse, I'd feel comfortable. And this is where laser therapy and minoxidil and finasteride, this is where they come into play. A lot of people, they think hair transplant surgery is the first step. It may be a step that's necessary, and it's a wonderful thing to do. But if you have some baldness and still hair remaining, the transplant only gives you new hair where you were bald. It doesn't do anything to your existing hair from continuing to fall out. So that's a mindset people have to think about a lot.
And I would agree. So the finasteride minoxidil, that's another good reason to make them all join together, because in order for the light therapy to have an effect, you have to still keep a follicle there. And so, the finasteride and the minoxidil, they all work to keep the follicles there so you can have the effect. If you don't have any follicles left, who's a famous bald person? Bruce Willis. If you're Bruce Willis, I don't care how, you're going to have to do a transplant is basically what it comes down to, because you don't have any follicles left to stimulate with the light therapy or the finasteride or the minoxidil.
Right. So, but the statistics are 1 out of every 2 men have male pattern baldness, and essentially 1 out of every 4 women have female pattern hair loss. And that's 80 million people in the United States alone. And they start off first by seeing hair in the drain. Yeah. Hair in the drain, hair in the brush, hair in their clothes. And that's what laser therapy treats very best. I use the percentage 90% to stabilize further progression and shedding, and 60% to regrow. That's my clinical observation over these many, many years. So if you can stay how you are and not get worse, that's a golden treatment for people to consider.
Yeah, and especially for our female patients who don't have the finasteride as a possibility. I mean, I use it off label in my postmenopausal patients, but like if you're young and all you have is minoxidil and you want to put it on your head or take it orally, well, you're stuck, right? Now you're going through hair loss. And that's, I think, one of the big areas of benefit is in our female population. It's like one of the only things that we have to treat them with that really works.
That's right. So I don't know, what else do we have to tell our friends out there?
I don't know. I'm trying to think of anything else. Go out and try, a light therapy device and make sure you pair it with some of the other stuff that's out there. Just
That's right.
don't
And
think of it as snake oil quite yet.
yeah, a scary statistic with hair loss also is that after 50% of your hair has already fallen is when a man or woman recognizes that the hair is thinning.
Mm.
So that horse is out of the barn long before you recognize something's happening. And what we recommend as two physicians who belong and are leaders in the International Society of Hair Restoration Surgery, you can look up online ISHRS.org and find a hair loss surgeon, hair loss specialist in your area and seek out medical therapies. You know, you can go onto TikTok and see they're using rosemary oil and all these other
Yeah.
things standing on your head to treat hair loss. Go to someone who's a medical professional and find out what your options are.
Yeah.
And I hope that whoever you go to will offer you photobiomodulation or low-level laser because it's an excellent therapy to consider.
Spoken as a true former president of the ISHRS.
And a future one for you.
Oh, God.
That's exciting.
Well, there's one other thing I wanted to mention, and that is even if you don't have androgenetic alopecia, let's say you're just going through a big shed. And here I'm thinking of, you know, my women who are postpartum, some of my patients who've gone through chemotherapy. Low-level light therapy can help you bring it back faster. So even if you're only using this as a temporizing measure just to help regrow some hair, and you don't have male pattern or female pattern hair loss or any other kind of hair loss, you know, as your baseline, this is something that you can use to help regrow it, and it doesn't have any side effects, and it's you know, literally so easy.
And speaking of, we're going back into the our talk again, but speaking of postpartum hair loss, it's very common.
Oh, yeah.
Common. Hair loss after someone delivers a baby. So patients would come to the woman would come to the office with the baby's crying, she's crying, I'm crying, everybody's crying because the hair is falling out. But the good news is if it's just telogen effluvium or this
A big
postpartum
shed.
hair
Yeah,
loss,
yeah.
it's limited. The hairs will grow back between 3 months and 6 months to lose it and another 6 months to regrow. So it takes time, but the hair will grow back. However, if you have the tendency for genetic hair loss, female pattern hair loss, and you didn't know it yet,
you can unmask it, right?
You will unmask it and the hair will regrow, but not as full as it was before you had the pregnancy. So that's something also to be aware of, and laser therapy will be very helpful with that as well. So
effective. Yeah, totally agree.
Good.
Yeah, that's where I've been too.